Sleep apnea is a condition which affects many people in our community. Patients who experience symptoms such as loud snoring, waking often during the night, excessive tiredness, irritability and depression during the day may do so because they suffer from sleep apnea. The term apnea means without breath. While they are asleep, people with sleep apnea experience repetitive periods where they stop breathing for sometimes as long as a minute. This causes their oxygen levels to fall, and this alerts the body to wake up. Patients may wake several hundred times a night without realizing it. The most common type of sleep apnea is obstructive sleep apnea, or OSA. This occurs as the result of the complete closure of the throat during sleep. When the suction forces of snoring cause the patient's tongue and soft palate to collapse into the airway. When the patient arouses from sleep, muscle tone returns in the throat and breathing begins again. A central apnea occurs when the central nervous system and brain don't coordinate to tell the body when to breathe. And mixed apnea includes elements of both obstructive and central apnea. Obstructive sleep apnea may cause a number of symptoms which can seriously affect health, work and family life. These include excessive sleepiness, which may put the patient at risk of a serious accident. Loud snoring and reduced sexual activity. Irritability. Memory lapse and intellectual deterioration, which may be interpreted as incompetence or lack of effort or laziness. There is also increasing evidence to suggest that sleep apnea may be a cause and/or a contributor to depression, hypertension, and serious heart disorders.
I didn't sleep very much for 7 years. I suffered from palpitations. I'd go to bed and I'd have a palpitation. I'd pump the adrenaline because I'd wake up frightened. I'd have the panic attack. And then I wouldn't want to go to sleep. And towards the end of the 7 years, I became very phobic about going to sleep. I'd do anything in my power not to go to bed. It affected my day-to-day life for the fact that I was impossible to get out of bed in the morning. There was a joke in our house, you never ever spoke to Mum in the morning until she spoke to you because she never knew what you were going to get. I was very, very hard to get out of bed. My husband at times has actually physically dragged me out of bed and put me in the shower. And other times the boys have got the ice cubes and they've enjoyed doing it and thrown them on me to wake me up. That's how hard I was to get out of bed. I also found that I was very moody and touchy.
I wasn't a well boy at all. I would love to do exercise, but I was too tired. I had lack of interest in everything, lack of enthusiasm. When I'd get to the office, it was lack of concentration. My work would suffer, and I have a very responsible job, so I started to worry about that. And then at night time, it would be, a real thunder slumber, because it was heavy snoring. And gasping for a breath of air would make my body jerk and my legs jump, and it wasn't a pretty sight at all, quite horrific according to my wife, because I'd stopped breathing.
One of the other things that did happen was that my poor husband was very solid as far as supporting me, but he got to a stage in the end where he was so tired and he was that frustrated because he couldn't help me.
Up to 10% of the population experience obstructive sleep apnea. and there are a number of characteristics that sufferers tend to have in common. They're often male, over 40, overweight, and snore while sleeping, and experience daytime sleepiness.
Do you find yourself actually falling to sleep?
Oh yes, I'm likely to fall asleep.
Not all patients with sleeping disorders have sleep apnea. However, patients who experience some of the symptoms mentioned should seek advice from a sleep physician, who may request the patient undertake an overnight sleep study in a sleep disorders clinic. As the patient sleeps comfortably, he's monitored, and breathing, depth of sleep and oxygen levels are recorded. The procedure is called polysomnography.
Oh, my night in the sleep lab wasn't too bad, actually. They wired me up and went through the whole wiring procedure, and I wondered how I'd be able to sleep with all this gear on, but I was fairly tired, but apparently I went out very quickly. I had to get up during the night to go to the toilet, and they just unplugged me, and I went to the toilet, came back, they plugged me in again, and I just went back to sleep.
On the screen we have a 2-minute period of the patient's sleep taken from the early hours of the morning, around 3:30 a.m. We can see from this tracing of nasal airflow that airflow is ceasing for long periods of time, and during that period of time the effort to breathe is continuing. The diaphragm activity is continuing and increasing as the duration of the apneic event or cessation of breathing continues. Airflow, however, isn't occurring, and for that reason the oxygen is being depleted from the lungs and falling in the bloodstream, and we can see the oxygen level declining throughout the apneic period.
A sleep physician may suggest that a patient with mild sleep apnea undertake a weight loss program. Reduce their alcohol intake, particularly within 4 hours of going to bed. Alleviate nasal stuffiness. Reduce or cease taking sleeping tablets or sedatives. Or improve their lung function by giving up smoking or improving asthma treatment. However, in the case of moderate to severe sleep apnea, additional treatment will usually be required. Previously, surgery was the most common option. But the innovative Sullivan nasal CPAP system, invented by Professor Colin Sullivan at the University of Sydney, is now the preferred treatment in most cases. The nasal CPAP system ensures that the patient receives a continuous supply of air while sleeping. This means that the part of the upper airway which collapses to cause apnea is kept open by constant air pressure. The nasal CPAP system has been designed for maximum comfort and convenience. The mask is cushioned for comfortable delivery of CPAP treatment, and the system operates extremely quietly. In addition, it's lightweight, highly portable, and very easy to use.
I found the mask very, very comfortable, very effective, and I felt after the first night I was a new man, and that's no exaggeration. It wasn't cumbersome, it wasn't a liability over my face. I just had the most magnificent night's sleep that I'd had in years.
The way in which the device works is by providing an inside-out splint. The background pressure simply holds the airway open, and the individual continues to do their own breathing. It isn't forcing air into the person, it's simply providing a background pressure. The device itself achieves this by having a very high flow, but very low resistance to breathing. And it's, in effect, placing simply the head in a higher atmospheric pressure. And that higher atmospheric pressure in the airway acts as a force to splint the airway open.
You won't even get a look into that, son.
Sleep apnea can seriously affect health, work and family life. But effective treatment of the condition using methods such as the Sullivan nasal CPAP system may have a dramatic impact on the patient's quality of life. Many people have found that the ability to sleep properly has reawakened their potential to live life to the full.
The key to it is the machine, the fact that because you are sleeping and you are getting oxygen all night, you are feeling better in yourself. Your esteem is getting better. You have more confidence in yourself. So therefore, all those other things are following through. But I really believe it's the fact that you wake up in the morning feeling good and the rest follows on.
Oh, well, it's been fantastic. I have no further lack of concentration. I'm a dynamo at work, at the risk of sounding very immodest. I no longer wake up with a burring head. I no longer wake up with a dry mouth. I go for a walk every morning at 5 o'clock for an hour, and that's a power walk. I have interest in everything. My exercise has improved enormously in other areas, and I'm just enjoying a new lease of life and feel as fresh as a daisy. I feel much younger. I feel 20 years younger.